Do you or someone you know suffer from experiences like this? If so, you may have narcolepsy, a chronic brain disorder involving poor control of sleep-wake cycles. Along with the overwhelming urge to sleep anytime and anywhere, other symptoms may include cataplexy, the sudden loss of muscle tone, feelings of weak, loss of voluntary muscle control resulting in total body collapse, hallucinations, either hypnagogic hallucinations occurring as you fall asleep, or hypnotic hallucinations occurring upon waking. These delusional experiences are vivid and frequently frightening. And sleep paralysis, the temporary inability to move or speak while falling asleep or waking up. All symptoms are usually brief, lasting 1 or 2 minutes. Awaking from an episode may cause confusion, just as understanding narcolepsy can. So, you may be asking yourself, what more should I know about narcolepsy? Doctors named Frederick Westphal and Franz Fischer, who observed the signs and symptoms of narcolepsy in their patients, first identified narcolepsy in the 1870s, but Jean-Baptiste Edouard Gélineau codified the disorder and named it narcolepsy in 1880. Today, narcolepsy affects both males and females equally and appears throughout the world. Narcolepsy affects around 1 in 2,000 people. Experts estimate that around 135,000 to 200,000 Americans have narcolepsy, but the number may be higher. Only about 25% of people who have narcolepsy are actually diagnosed with the disorder. Patients are often mistakenly diagnosed with other conditions such as psychiatric or emotional problems. Many patients wait decades before receiving a proper diagnosis. Most patients experience the onset of symptoms of narcolepsy between the ages of 15 and 30. Although the precise cause of narcolepsy remains unknown, a common occurrence among most people diagnosed with narcolepsy is low levels of the neurotransmitter hypocretin, which promotes wakefulness. Up to 10% of individuals diagnosed with narcolepsy with cataplexy report having a close relative with the same symptoms. Experts estimate that around 8 to 10% of narcolepsy have a close relative who has the disorder, though the risk for narcolepsy among first-degree relatives, parents or siblings, is only 1 to 2%. It has been theorized that narcolepsy may be an autoimmune disease in which the immune system may be tricked into perceiving its own proteins to be antigens, foreign substances targeted for attack by immune factors in the body. Narcolepsy cannot yet be cured, but some of the symptoms can be treated with medicines and lifestyle changes. Doctors prescribe central nervous system alerting agents such as modafinil to reduce the incidence of sleep attacks. Common side effects include irritability and nervousness, shakiness, disturbances in heart rhythm, stomach upset, nighttime sleep disruption, and anorexia. Another medicine used to treat cataplexy and excessive daytime sleepiness is Xyrem, primarily used only for narcoleptic patients. With no known cure or exact cause of this lifelong condition, there are organizations around the globe providing not only information and support to people with narcolepsy, but time for research as well. Scientists are conducting investigations using animal models to identify neurotransmitters other than the hypocretins that may contribute to disease development. A greater understanding of the complex genetic and biochemical bases of narcolepsy will eventually lead to the formulation of new therapies to control symptoms and may lead to a cure. When having narcolepsy, you may feel that you are the only one who knows what it's like, but truly, you are not alone. Many famous figures through history and present day have been known to be diagnosed with symptoms including Harriet Tubman, Thomas Edison, Kurt Cobain, and Jimmy Kimmel. Living with narcolepsy may be difficult, but just remember, there's a nap for that.